I've always thought of myself as a family doctor, so I take care of my patients and keep them healthy, but in return that also keeps the family healthy. And Lyme disease is a disease that should be covered both in veterinary medicine and in human medicine together. We're very excited about this campaign and really trying to bridge that gap of keeping these two medical entities separate and working together so that we can educate from many different aspects about how to keep the whole family healthy. We as the veterinary medical community have always known about Lyme and now Anaplasma, Ehrlichia, Rocky Mountain Spotted Fever, the major tick diseases that have been discovered previously in human medicine. But we're now learning that there are tick diseases out there that we haven't even named yet. There's other vector-borne diseases associated, again, mosquito-driven diseases that are getting a lot of press lately. So it's very important for us to constantly be protecting the pets, which also protects the family, making sure that there is money for research so that we can keep up to speed on what we're diagnosing and how we can best treat it, and also educating the families on how to make sure that these vectors, these ticks, aren't constantly coming into the home. It's very important for me as a veterinarian to make sure that when I have a pet owner that comes in and we've diagnosed Lyme disease or we're talking about tick disease, I always make sure that I educate the pet owner on what a tick looks like, because I think that's actually a very important fact that we're missing in some of this is people get confused and maybe are just unaware at how small ticks actually can be. And when you're screening a child, there's a lot of skin that a tick might show up a little bit easier. But when you're screening a dog that has a heavy coat, it's very, very easy to miss ticks. And so to me, that again is part of that four-prong approach of teaching an owner how to be screening, which also I think in turn helps them screen their children and themselves.